Buongiorno a tutti, vi pregherei di...
Good morning, everyone. I kindly invite you to take your seats. We have quite a demanding day, so we can start. Minister Schillaci has just arrived and is going to reach us in a few minutes.
siccome poteva andare a Washington, se tu mi fai la cortesia, io sono no, anche esatto.
Mazza aperta,
La mia è bassissima.
Ecco, buongiorno, direi che...
Good morning. We might start. Let me welcome you all. I would like to welcome also those participants who are connected remotely with us, the European Commission. We have a streaming live into English, which has already started, I suppose. So welcome to this presentation of the national program HTA Medical Devices by the Minister for Health and the National Agency for Healthcare Services and the Regions Conference. I'm Stefano Di Marzio, the Director of About Pharm, and I'm pleased and honored to introduce, for institutional greetings, Minister for Health and the host, Professor Schillaci. On my left, far left, no need for introductions, the President of Agenas, Enrico Coscioni. On my immediate left, President of the Commission for Healthcare Social Affairs, Francesco Zaffini from the Senate. I can hear in first row sitting, I'm greeting, and I will then invite him to greet the audience. Professor Rocco Mananton, the President of the High Institute for Health, connected remotely with us, the President of the Conference of Regions and President of the Friuli Venezia Giulia region, Massimiliano Federica, and we will listen a video message from Sandra Gallina, the General Director Health and Food Safety of the European Commission. I would like to, without further ado, give the floor to Professor Schillaci, who's going to introduce this very important day. Thank you. Thanks. Good morning, everyone. Let me greet President of Agenas, Enrico Coscioni, the Director of Agenas, Domenico Mantuan, President of the Regions Conference and Autonomous Provinces Connected, Massimiliano Federica. Let me greet Senator Francesco Zaffini and all the speakers here attending. This initiative accounts for a very meaningful occasion to introduce the national program HTA for medical devices. I believe today's conference stands for sharing of opinions to truly set and define instruments and modalities to enhance an activity that I believe is firmly strategic. That's HTA. It's a methodology that in Italy struggled a bit to be consolidated as an approach to rule healthcare technologies, despite it's pivotal to grant patients a fair access to healthcare services and also guarantee sustainability of the national healthcare system. Eventually, after roughly 30 years of the first experiences of HTA implementation supporting decision-making processes of the healthcare national service, today we can state that technology assessment is a true reality with the final launch of the program that we are introducing today. You all well know that the approach chosen by the EU shall harmonize the assessment models of drugs, medical devices, advanced therapies in European states with a cooperation model forged over the last 20 years, which was shaped in 2021-2022. European model came into force the 11th January 2022, will be fully in force from 12 January 2025 in all European countries. This is making us think if we are ready to embrace this challenge that is coming once again from Europe in this essential sector. The answer is, of course, affirmative. We have years of experimentations. This trial allowed us to test this cooperation model between the Ministry for Health and Agenas, which played a strategic role in this field, promoting the importance of this approach. IFA, the regions, the academical centers cooperating, scientific societies, and the main stakeholders of the healthcare system. Over these years, we lacked specific assets for the financing of such a complex and sophisticated engine. It's a gap we are bridging with this program that is sustained by funds that are fair and suitable, and especially the competence is important. I'm firmly committed that the Ministry for Health, through the Control Center at the General Directorate for Pharmaceutical Services and Medical Devices, shall be a driver and leading a role to coordinate and relaunch technology assessments. The lack of financial resources, the need to govern this disruption of innovation that cannot be but welcomed and appreciated, especially for our patients. But this is not always sometimes simply to the benefit of health. So the HTA is a must-be approach, as value shall underpin the purchasing and procurement processes. Decision-making processes shall be based on scientific evidence for the clinical impact, the potential financial, ethical, and clinical approach of this practice of new healthcare technologies. To let you understand the scope of the HTA national program, we'd like to highlight the synergies and connections with one of the main activities of healthcare planning at the national level, among which I quote the updating and monitoring of the essential level of assistances and all the processes that do relate to the reimbursement and codification of healthcare provisions and the ARG. This new challenge that is looming, I'm certain we will face it strongly, and I know I can count on the delicate role of technical scientific coordination of Agenas, its know-how on this field, and the proactive contribution of the regions. Let us not forget, within the field of the different regional healthcare services, we need healthcare technologies, and from there, we have a whole set of different purchasing processes with efficient and effective governance at the regional level of these processes, the introduction and use of new technologies. We can achieve a governance system with these healthcare technologies. This is to meet the needs of healthcare for patients who still are, of course, at the center of our attentions. Let me conclude. The adoption of this program is accelerating strongly the updating of our national healthcare system. We have a tool allowing us increasingly to base our political and national and regional healthcare policies on robust scientific evidence, enhancing all the different stakeholders. From now on, we are launching a new model of cooperation between the state and the regions. For us, it is actually a working process that allows us to share governance at all levels of the national, European, and regional system up to the corporate one. I'm firmly convinced that only if there is a sharing, if we are all moving in the same direction, we are going to reach this milestone of modernization of public health care. That's our target we need to our citizens. Thank you. I wish you a fruitful job for this important day.
Bene.
Very well. I wish you a good day. Let me greet you all. I'm really happy to be here. I'm not a physician, that's for sure. I would like to clarify this every time, because my approach is to connect the political scope, or anyway, my institutional role, that's the president of a complex and complicated commission, as the 10th Senate Commission, that is comprised of fields like healthcare, public-private work, and social affairs and evidence. You might realize with 5 ministers belonging to the Commission how complex it is. More specifically, healthcare is the core, the universe where I've always been working in the long years of experience in the political setting. What I perceive in these circumstances, the need. In these days, we have been a lot talking about the resources in the state budget for healthcare, but I believe that you all have the same feeling many times as I have, that we are filling water in a old tank. So these resources, the more we give them, just think of the waiting lists. I was watching a TV program, I believe it was a report or a similar show, where Formiconi was chased along the road because he was the one who, due to this long waiting list, he invented the agreed upon services for private healthcare. So to solve the issue of waiting lists, today we keep on pouring 3 billion funds to solve the problem of waiting lists. That's what I mean. If we do not act on these controls of expenses and the right balance between investments, returns, and sustainability, this huge problem we have that is looming on us, not only in Italy, of course, but especially in Italy, I'm concerned we are not going to find a way out. And unfortunately, this goes to the detriment of the citizens, fragile citizens who need care, and these needs are not met. So today is particularly important. I can see in the agenda so many hints and needs to act, try to stem expenses by the ministry. So in tight connection with the regions through Agenas, that's and political operation that is absolutely fundamental. As far as I'm concerned, besides from the trust towards Orazio Schillaci, who is on my side from the very first day of this legislation, with our, aside from our friendship, the confident work, I'm convinced the important work that he's doing. And I joined this complex operation to connect the political sphere and political decisions to the actual needs of these new technological acquisitions in the healthcare. Finally, I would like to briefly hint at this attempt. I did it when I was introducing, showing and struggling to show the amendment on bio-advanced technologies, and I hope with Orazio, with your help and cooperation, to start this new fund on advanced therapies. We are perfectly within this journey, and that's the way we, as strange actors of the political sphere, we can try to help you. If you, as I always say, cooperate positively, we can reach good results despite all these budget constraints that keep on insisting on us. But again, we are pouring water in a whole tank. If we do not close this hole, we can pour any amount of water, but it's going to be out of this tank. So thank you, and I wish you all a fruitful job. Thanks, Senator. Let me leave the floor to Professor Enrico Coscioni. Let me thank the host, the minister. Good morning, everyone. I believe that Professor Schillaci provided us with the core pillar of our discussion. Europe, available funds, and a new governance of medical devices. I think that's the goal of the HTA action. The minister technically supported and also operationally from Agenas is fully committed eventually, in the end, it seems, on this fundamental moment. I particularly thank Enrico Antoine, my director, and Agenas director. Since he came, we were strongly driven with activities and proactive actions. And Marco Marchetti, in particular, General Director of Agenas, who believed in this project from the very first moment, further articulated these themes. And Professor Schillaci knows that right now we are also coordinating European joint action on HTA. So why all this? Because without governance, there are big problems. One of these then resulted in the payback of medical devices, because we missed control. I perfectly agree with the words of Senator Zaffini. It's not the first time. I perfectly agree with him. And the first thing I wonder in the morning as a surgeon, as a physician, is the suitability. It's not only a matter of money. Money is important, of course, but also the possibility of changing rules to improve them to be so that these resources can be leveraged. That's fundamental. And within this, we could start a discussion, as the healthcare system is extremely complex, not complicated, complex. And those of you who know the healthcare well, you acknowledge that it's hard to intervene on certain processes, and on medical devices specifically, we have lots to do and say, because it cannot be simply that the device would comply with some safety mechanisms. It shall be framed, as we are moving more and more, and we will do that increasingly in the future, thanks to HTA and digital healthcare, through systematization of intervention in this care path that is codified and validated for the system. Just think, Professor Schillaci, the return that will have, the impact on devices from digital healthcare. So this is an extremely interesting day. The discussions will be absolutely important for the future development of the activity that we will enact. This symphony is very important. I will stop here for the sake of time. We're going to have a long day, fully packed with important interventions. Thank you. Thanks, Professor. I think that President Federica, who is listening to us, might share. I welcome you, and I'll soon give you the floor. This cooperation mode that is in our room and at this table. Please, President, you have the floor. Thank you. Let me thank all the attendees, President Coscioni. A special greeting, of course, to Minister Schillaci, with whom I frankly say there's an everyday constant cooperation. A special thanks to Agenas, General Director, who participated to the region's conference and this event. As you know, as a region, we signed a memorandum of agreement the 16th of May this year, followed by the publication of the decree of September on the official journal. The regions are firmly convinced in this path. They're convinced because it's clear that to systemize the procurement and the choice of medical devices accounts for an essential instrument for the provisions that regions are providing to citizens and for the sustainability of the system as a whole, also from the financial viewpoint. On this, I perfectly share the different objectives you have recalled, but I'd like to underline the role of the regions. They are engaged and can play their contribution for an efficient system in view of a cooperation and institutional alliance. I'm thinking of the local implementation that we are supposed to perform, and all the operational side and the transition of these choices practically. We participate in the HTA process with the regions who are directly involved. This allows us to guarantee future perspectives of the single regions, factoring in the assessments that, of course, will be done. We, of course, participate to assets allocation, the regional programs organizing healthcare on different territories. We are engaged in monitoring and assessment. We would like to involve, and we shall engage, also the regional stakeholders in this process. We can share best practices among the different regions, and of course, within the scope of compliance that's fundamental as imposed by national guidelines. The great advantage for our citizens through HTA, we can no longer be based on a controlled innovation, but on a public system that can provide prompt answers to the constant innovations in this field that in certain cases are not in line for the approach and the responses we might give to the patients. So as far as we are concerned, and I'm going to my conclusions for time limits, of course, the available resources have to be underlined, given by Agenas to the regions. I mean, the future of the healthcare system, that is, of course, highly complex and raises lots of difficulties, there's no doubt, depends on the capacity of planning, not only observing today's critical issues, but also understanding how we want and which will be based on the consequences of the scenarios from now to the next years. The critical issues we have today, I'm concerned, are the result of a lack of planning in the last decades, not in the last years. Today, we need to make this effort with an outward looking beyond today. Otherwise, we run the risk of looking only at the emergency situations without solving or tackling from the structural viewpoint the issues and problems of the healthcare. This would lead the country simply to tackle a constant state of emergency instead of structuring an healthcare service that might be robust and provide answers. So I'm going to my conclusions. We need bold choices. So all regions have to question themselves, and of course all the actors need to be challenged, and also the political forces shall challenge themselves. We cannot think that we could use the scapegoat of healthcare for political issues. I'm sorry, I'm explicit, but I am part of these political processes. We have to be accountable because these bold decisions have to be, of course, explained, narrated, communicated, explained with their outcomes. So if we are moved by fear, instead of rationally analyzing the right answers to be given to our citizens, we run the risk, in perspective, of not having that planning I was referring to and we should all hope for. Thank you, and have a nice job.
Grazie Presidente Federica anche per come ha orientato questo dibattito che sicuramente svilupperà alcuni.
Thank you very much. I think your remarks will be further developed also in terms of choices that we need to take also as citizens. I would like to ask to you if you think that we need to develop further this topic in a wider way.
Ovviamente un saluto al signor Ministro. Saluto al signor Ministro.
Welcome to the Minister and to the authorities, our friends from Agenas. I will be very short and to the point. I know that you really can't wait to listen to further statements and speeches, but I really want to share with you our contribution as from the institutional point of view. We have been cooperating a lot so far with Agenas, and I really think that in the future there will be deeper cooperation. I think that the Minister, together with Agenas, together they have decided to work on this topic. And as one of the stakeholders, I think this is a really very important issue to talk about and to deal with. As far as the current medical devices, we need to be concerned about the aging, the old age of these tools. We actually need to face the most difficult and crucial moments when we use these tools. There are lots of patients, thousands of patients in Italy that do not follow radiotherapy cures because we have obviously not updated tools, and because devices have they get old, you know, so they are out of date. It happens. We are actually always assessing by the Ministry of Health, by the different stakeholders, as far as the use of the new technologies is concerned. We doctors, the medical staff, we tend to use the very last technologies, regardless of the fact that there was an accurate analysis of technology assessment, in order to understand that this very expensive technologies that is much more expensive than the previous one, has actually real benefits. The other problem, and I'm going to conclude here with, is related to the minimum criteria with which department in a hospital can work properly. There are many cases in Italy where department works with a certain device just once a year, or in a word, they use it just very occasionally. And with clinical risk, be faced with that, and also spending a lot of money. We have different surgeries like hernia and others that are dealt with in balance with their high cost. And of course, when we work in a ward, we should be aware of the situation and be able to find the right solution. So Agenas and the Ministry of Health, the different stakeholders will be able to find the right way and the right path to follow. Thank you very much.
Ecco, direi che dovremmo...
I think that there is a video now. Dr. Gallina, that's the video we're going to... So, distinguished guest, dear Minister, thank you to Domenico Mantovan and Marco Marchetti for having invited me here from the Regional Health Authority, Agenas. I could not be with you but physically, but I didn't want to give up this great opportunity. The European community role is very important. So approving the national program, HTA, for medical devices is actually really to the point. It's happening, it's occurring at the right time of our European Commission issues. It will be applied in January 2025. And this is the first result in the pharmaceutical sector at the European level, and it is very important for the European health and to underline our important role, more access to drugs, to high technologically advanced medical devices. This is a way to analyze, to have agreements, to look at the emergency issues. It deals with methods, relationships between the different stakeholders, and the search of common solutions. The in vitro medical devices, for example, the high-risk devices and their use, they will be the main focus of several activities after being in the market, put in the market. From 2025, the European Commission and the European member states, so from 22 to 25, they will be followed by a coordinating group of the European member states. And I really congratulate with the Italian stakeholders, because one of the stakeholders, Marco Marchetti, has done a great job. Of course, we need more cooperation, more coordination. All the different stakeholders in the health sectors, as far as medical devices are concerned, they have to be able to work in a much stronger and deeper way. They all have to share common goals, and the ways that the stakeholders will be in touch and collaborating can be further improved. I think that we also want to strengthen the scientific evidence after the evolution of scientific knowledge, the rules involved. I think this is fantastic. Scientific consultations that work hand in hand with the entire system, so will favor the entire process. So I really congratulate and I wish you the best for the approval of the national program. And I congratulate also for your actions aimed at supporting and assisting the entire system related to the world of medical devices. I really wish you a fruitful session and the very best work in this field.
Con l'intervento.
With this video message, we conclude the first part of... I would like to add something, if I can do that. Just to conclude this opening session, I would like to go back to what Senator Zaffini said before. President Federica mentioned that too. I think it is something complex, as I said. During a parliamentary auditions, now there is a lot at stake, more than it was in the past. We need to change our attitude. We need to change the entire health system. As a minister, I have ideas, we have ideas, and we're going to put them into practice, to implement them. In the past, things were not the same. Thanks to Agenas, thanks to the health authorities, the ministry, we will do our best to implement our ideas. Thank you, Mr. Minister, for your remark. We have to say goodbye to Senator Zaffini.
Vediamo dopo.
Ecco, in questo cambio di sala chiedo intanto al dottor Marchetti, che è il
Please, Dr. Marchetti, he would like to... He's our amphitryon here. He's going to present in a very detailed way the national program HTA for the medical devices. Good morning to you. Before starting your speech, we would like to give the floor with another video message. Mr. Battista, Dr. Battista, he's an expert in epidemiology at the University of Montreal, the creator of the discipline of HTA, and he was director of the HTA agency in Quebec. Before starting, I would like to mention something.
Ecco, a un congresso recente.
In an HTA Congress that happened in the past, occurred in the past, I think that we can talk about ideals also in terms of a debate. So these quotes, for example, Mr. Cicchetti, he's one of our speakers, became director of the planning of the ministry. And he's not here now. Maybe he went to stay to greet the ministries. And then we have Mr. Domenico Mantovan, one of the responsible people in Agenas. If Mr. Marchetti agrees with me, I think we can perceive what are the expectations of citizens from HTA. So to explain to citizens what is right, what are their needs, how they can be self-determined in terms of needs, And mainly, what we have just realized, the role that the academy, the experts must have and have to support politics, because politicians need to take the right decisions. So I think we can share now the message of Professor Battista, and we're going to listen to that. Mr. Ministro Schillaci, Professor Coscioni, President of Agenas, Dr. Mantoan, General Director of Agenas, Dr. Marchetti, Manager of the Operative Unit HTA in Agenas, dear colleagues and friends, I really thank you for inviting me to be here with you today. Thanks to the magic role of communication, this meeting is absolutely the end point of long-term commitment and hard work at a national and international level. I'm really honored about that. When we talk about these issues, it is, because we are in 2023, it is different as we would talk about it in the last decades of the 20th century and in the first year of the 21st century. The contribution, the necessary contribution of science and research, the decisional processes as well, the political role, all of these is quite clear now. In 1989, I was in London for a speech for the International Society of Technology Assessment in Healthcare. I met, in that occasion, Mr. Favoretti, who came from the world of hygiene and the management of the health sector, and he worked in a Padua hospital. We realized that HTA was something quite complex, but more concrete, more practical, less abstract. We needed to find out a new strategy to create a bond, a link, a necessary bond between researchers, decision makers, and managers. The first debates were very important, and we found out that there were two important elements. We needed to create in the Gemelli Hospital an assessment system, and the second one was important to create an Italian society for HTA. The first goal was implemented quite easily in a short time in a very favorable international context in the creation of a practice of HTA within hospitals. The goal to create an Italian society of HTA was a more ambitious goal indeed. It required more patient and targeted work in order to put together dynamism and different stakeholders that were not yet together, they were isolated. The team in Rome was really fundamental for the evolution of the entire project. Besides that, this group was able to bring in Rome the annual conference of the Health Technology Assessment International in 2005. It was a great success, and it was a very important occasion to recognize Italy and its role at an international level as far as HTA is concerned. Today, the presentation of the national program, the HTA national program about medical devices, and it's a result of a very deep and layered, multi-layered work. It is also the fruit of a cooperation, the cooperation between the Ministry of Health, Agenas, and the regions, but also the autonomous provinces and autonomous regions in Italy.
Regolamento europeo.
In order to apply the European Communion rule, it looks like a very well integrated approach that links the medical devices to purchase and planning of political devices within a European framework that will see Italy as a real protagonist of this very important process. I'm really happy today to participate to this event, even from a distance. This is an historical event. And as the French writer Jean Daumasson wrote, the future without the past is blind. The past without the future is sterile. And I would like to conclude here with saying that I'm fully convinced that the future of HTA in Italy appears really fantastic. So I wish you a fruitful work and my very best regards from an autumn in Montreal, Canada. Goodbye.
Direi che l'endorsement
Dr. Marchetti would say that the endorsement by Mr. Battista is important. He mentioned the Roman group, and you are certainly one of the protagonists in these years. I wanted to ask you straightly forward something to start this intense morning. Some days ago, we met at an event, but Pharma, we organize this event each year dedicated to medical devices. And somebody asked you, an expert on HTA, it's 20 years we are talking about it. What's new? And quite diplomatically at the time, now we probably will add more now, he said that now we have a solid legislative framework and financial availability that's important. And allow me to add, that's cooperation and integration among state and regions, parties, and now also the European Commission that has organized a rich HTA legislation program. If you want to go on by detailing what's new, I would say that's the right time to do that.
Allora, grazie.
Thank you for this introduction. I'll try to, in this 25 minutes, to provide you with some description, let's say, of what the national program is and what it envisages. First, I would like to say what is the field of application, because we talk about medical devices, but to better understand the scope of this program, I've reported here the definition that is given by the two European regulations, 745, 746, 2017, on what's a medical device. A medical device, I've highlighted some terms. We refer to medical device when we indicate each instrument, device, appliance, and software. And as for the software, I will further explain a reagent, material, plant, which has a medical purpose and use, distinguished by the drug because it doesn't have an action through pharmacological and immunological mechanisms. When we talk about a medical diagnostic device, we also refer to vials with biological samples that is then analyzed and tested. That's the definition that comes out of the EU regulation. I made a hint at the software theme because in the software field now we have a new category of technologies that is emerging on the market. That's the digital therapeutics that are classified as software. These are usually a 2A class, some also in the 2B class. Some EU countries started to set reimbursement and first assessment and then reimbursement procedures ad hoc. I'm mentioning Germany, DIGA procedure approved roughly 40 digital therapies that are reimbursed in Germany by the state. France started this year with a program called Backup. So a new scenario is being opened for digital healthcare that's quite wide. Then to give you a conclusion, here I've reported a sentence taken from the governance medical devices document of the Ministry for Health. It mainly says that in the category of medical devices, there are all the products that are no drugs at all levels of complexity and cost, from big appliances to simple consumables to the bed of the patient. So we are referring to a field of application that's really very wide. Of course, the national program will focus on the most impactful technologies, but it's just a frame. I think it's also useful to remind the regulations evolutions that was more than once mentioned today. Everything in Europe started in 2004 when the European Commission introduced the HTA as a political EU priority. It was a joint decision by the EU Parliament and the Council of Europe defining HTA as a priority. From then on, a whole set of actions started finalized to develop assessment technologies at EU level. I also remind you that the first version, the first time we mentioned HTA in a document in Italy, is a National Healthcare Plan 0608 that precisely refers and recalls the text of European recommendation in which the healthcare plan mentioned the need to implement an assessment, the health technology assessment plan, to foster sustainability of the healthcare service. From 2004 on, we started many actions at the EU level, led first to the financing of research projects and the creation of what by now we all know as the European Network of Technology Assessment, started in 2005. And it was constantly financed, first with a research project and then through joint action mechanism. The joint action, I remind you, allows the EU to finance joint actions of member countries within the scope of a whole set of targets, among which also the evolution of an assessment path. So the EU funded the European Network of Health Technology Assessment up to 16 September this year, when the service contract on 21 expired, and the whole accountability was in the hands of what Professor Gallina was mentioning as the EU coordination group. In Italy, in the meantime, we reached 2014 and 2015 when in the two stability 190 and 208 laws, the 190 sets the national HTA program, the 208 medical devices, entrusting this responsibility for drugs and technologies to the National Agency for Drugs, AIFA. 208 sets the monitoring of the national HTA program, up to reaching 2017, when the first memorandum of understanding of the State and Regions Conference was taken on the strategic document of HTA national program. This was the first step that this program then continued to extend, and to a certain extent also it has been overcome. We then reached the approval in 2015, and here we move to the EU part of the Directive on Cross-Border Mobility. Article 15 envisaged a new endorsement, now no longer as a priority, but as a guideline for member states. The European directive is not immediately applicable, but has to be transposed by the member countries on the need to create a European cooperation network on HTA to promote the regulation of assessment methods and thus streamlining the access to innovational therapies for patients. An impact on health 2019-2021 was signed. Among the different actions was a reorganization of the competences and functions of the different actors in the HTA field, committing somehow the state to reorganize efficiently all the structures that at the time were dealing with HTA, with the precise goal of finalizing and maximizing the use of resources and results. At the EU level, in 2018, started the negotiation of the regulation on HTA for 4 years. 13 December 2021, the European Parliament approved this regulation. It came into force 11 January 2022, and as reminded by Professor Gallina, it was applied since 12 January 2025 on oncological drugs, from 2028 on rare diseases drugs, 2030 on all drugs. As for the devices, tomorrow we're going to organize a meeting in the coordination group where the timeline is going to be decided. This means the timing of the joint work on medical devices. In Italy, in the meantime, in 2021, Law 53 was approved. That's Article 15, subparagraph F, and strengthened the HTA program with its connection with purchasing processes. From then on, a whole process started, which was quite demanding, and we are fully committed to reach on September 2022 the publication on the official journal of the 2 legislative decrees, 137, 138, which redesigned the governance of the HTA Italian system, and mandated Agenas to submit a technical proposal. That's what we are introducing today, the Memorandum of Understanding and State and Regions Agreement last 12 May. And as President Federica was mentioning, was then published on the official journal with the decree by the Minister the last 5th September. I would like to conclude with this legislative history, completing what was done at the European level, as anticipated by Professor Gallina, referring to the new pharmaceutical legislation. HTA stands for one of the pillars on which what is called the new pharma legislation is based, and one of the pillars on which the European strategy for health is based, that gathers many actions which came into force starting from 2017 onwards. Then COVID accelerated this process to regulations on medical devices 745, 746, 2282 on HTA, and the currently debated pharma legislation on the data space, and finally AI. These are the pillars on which the whole European strategy is based for health, and today we have based the national HTA program on this. I go to describe the main features, which are the objectives of this program. 2 main goals. First, as reminded more than once during the greetings, to bring this instrument to support the decision-making processes to all the policymakers of the national, central, regional, and local actors with the decision-making level, wants, accountabilities, and modalities of actions, and also the requests for support that are diversified compared according to the functions and services that can be offered by HTA. Second point on which the program was hinged is connected to the application of this program to the full life cycle of technologies. This means in a phase of innovation, R&D, when technologies are being developed, and Professor Gallina was reminding one of the activities envisaged by the regulation, the joint scientific consultations, to drive technology towards these technologies that are requested by the system. When technologies are developed, they are ready to penetrate the market, and that's what we are introducing today, the new program. But, and this is one of the goals of the new program, is to assess those technologies that have become out of date and have to be dismissed from the system. At aggression, the joint scientific consultation at the EU level in the HTA national program commits to produce within 2.5 years, 2025, a document regarding the program of evidence production. So the national program has envisaged a consultation and guidance step for new emerging technologies. The new governance was mentioned more than once. Minister for Health, Agenas, Minister of Health as a guidance body, Agenas as a technical and scientific body, supporting the national HTA program through basically two actors. The cooperation centers of the HTA national program, supporting Agenas in producing the assessments. So Agenas is a scientific technical body in charge of producing the assessments. We do that turning to the best competent centers in the country, and probably not only in the country, if we put it in a more international scope. That's going to be done, and that's one of the features of the program, through the regional agreement that was set some years ago with Law 190 that was never fully enforced. That's the commitment that we have more than once mentioned during the greetings, also by President Rodriguez, to have an active role in the transferring of the outcomes of the HTA national program, the assessments, into the operational daily purchasing processes and the clinical practice of every day. Another important issue, still regarding the European regulation, is the dialogue with the stakeholders. So the program sets the creation of a stakeholders network, producers, scientific societies, patients associations, to create a moment of joint discussion on everything that could hinge on the critical opportunities and themes that might emerge from now on when the program will start to be operational. Technically, so what is this monitoring center doing? It validates methodological guidelines that will be applied to the production of HTA documents, identifying the technologies that are needed to be assessed, defining the priority of these assessments, and after the assessments, it drafts recommendations for technologies that went through the assessment, so recommends or not the adoption of this technology. Agenas, as scientific and technical bodies coordinating at the national level all the bodies and public and private institutions involved in the PNHTA, the cooperation centers I was mentioning, coordinates the network of regions to define the transferring of the outcomes of the assessments in everyday operational systems to create an actual governance system for medical devices. Of course, it defines the methods and procedures for the production of technical reports, produces the assessments, provides a full technical support to the monitoring center in defining priorities and appraisals, and the introduction that is particularly emphasized in this new program is monitoring. Monitoring of the national program performances. Of course, we want it to be fully transparent and assessed for its performances, but also to monitor the actual impact of these assessments. It's not an objective of this program to produce assessment documents that will stay in a shelf. The goal is to produce documents of assessments that are transposed into decisions in the clinical practice. In this context, we refer to the monitoring of medical devices consumption, big and medium-sized appliances. Very important. We're going to back on this, the communication of training. Another important actor, I would say fundamental, essential, if we want to transfer these results into practice, these are the regions through the regional network. They are the actual connector between the assessment produced and the operational side. In all healthcare companies, hospitals, clinics, purchasing centers, it's there where the technology needs originate. And we, as a national program, we have to detect these needs, define priorities, assess. Once we have evaluated this, we have to define processes, practical procedures, transparent and rapid procedures to introduce these new technologies in the daily settings. The cooperation centers producing assessments. The stakeholders are this neutral space where we are not going to talk about technologies, rather processes and methods to have a return in terms of opportunities for improvement. So which are the pillars on which the program is based? The main objective is the implementation, transferring into decision-making processes. To do that, we need some fundamental actions. First, a cultural change. It's not enough to produce assessment documents. We need to change this cultural approach to the HTA. It's not enough to produce assessment documents. We need to monitor these assessment documents, what's the impact they have, and if they're not impactful, trying to understand why and correct our actions. How can we reach these milestones? Basically, through 3 steps or phases. First, the analysis of needs, to understand what is needed by National Healthcare Service, assessing this need. Once evaluated, draft recommendations as to the adoption of these technologies. Which are the actions envisaged that Agenas is being empowered to move on? Cultural change. I think that's maybe the priority at the beginning of such a program. That's why communication is important. We have envisaged today the presentation of the national program in the first 6 months, 2024, to organize informational days in the Italian regions where we will engage the policymakers from the regional to the corporate level. Because if we bring on board, if we buy in policymakers and we do not have their full commitment, we do not have many possibilities to enact this program. Training as well. Training will be articulated according to the concept we are having at this level, the basic training that's going to be extended to all the different operators of the national healthcare system. We have estimated in the program to train thousands of operators per year and an advanced training for those key operators in policy-making processes. This is all financed with 1/3 of 0.75% of the fund. It's a huge investment that the country system is already doing, trying to change the cultural approach. It's not going to be a one-spot solution. It's an ongoing action for the whole duration of the national plan that will accompany national plan for its whole evolution. So messages will change and the objectives that will need to be reached through this communication and training activity. The analysis of needs. According to the program, there are different actions. The first, as per European regulation, identification of emerging technologies that are being launched on the market. What do we expect to have in the next 3-4 years in medical devices? Then, and that's maybe the most consolidated actions, the portal of reporting notices. We are finalizing this in order to make it more efficient and usable. And news for the national program is the creation of a portal for the procurement purchasing requests management. We're convinced that the need for healthcare technologies is originated in the healthcare structures. And we want to fully understand which are the technologies that our physicians and clinicians are asking, defining then the purchases we need to intercept these requests. So we have to strongly work with the regions to identify this workflow that we as Agenas will implement using the 0.75% fund to streamline the work in the healthcare agencies, the governance of the regions, to report at the national level what's the actual need to assess not only technologies, but also what's the financial amount needed to finance the use of these technologies. The core item of the program is, of course, assessment, and that's emphasizing a change compared to the previous infrastructure. And referring to your question, what is different? Well, accountabilities are clearer. Thus, if the monitoring center of the Ministry for Health has this coordination and action and decision role, Agenas is responsible, and we are going to measure ourselves. This is one of the objectives of the performance measurement of the program for this assessment. So the responsibility of assessments falls within the accountability of the Regional Services Agency, the coordination of centers where the expertise is used, complying with all rules of transparency, conflicts of interest, and regulations on the assignments for the use of common resources. Agenas is going to set template and procedures on which to base these processes, producing assessment documents that by law are entrusted to the monitoring center to validate the technological guidelines. So these documents will be assessed by the monitoring center in terms of their methodology. Another action we have foreseen in the first months next year is to create, once the cooperation has been set, an IT platform for cooperation that will allow Agenas to coordinate operationally the work of the different cooperation centers. I'm referring to the same activity we are doing at the European level with the creation with an ICT platform that's under the responsibility of the European Commission. So we will create this checkpoint, this shared platform to manage the whole process, from the reporting to the prioritization, the assessments, and the appraisal and recommendations. Final action, the recommendations. They fall within the responsibility of Minister of Health, the Monitoring Center, the Drug and Devices Directorate, chaired by the Ministry, to adopt, according to the product assessment documents, an appraisal as regards the use or non-use in the clinical practice. The old document, strategic document of 2017, had 4 kinds of appraisals in the use or non-use, use in research, or conditioned use. The methodological coordination of all this appraisal procedure is entrusted to Agenas. Which are the actions we expect to foster the implementation? Well, first, the creation of a data bank of assessments, so sharing all the works that are done on the national and international assessments. And I go back to your comment on the portal for the procurement requests management. In the mechanism we have envisaged, we wrote a technical proposal to define from simpler to more articulated or complex assessments. So this portal should help companies and regions to manage their assessment processes. What's our goal? We strive, together with the cultural change we want to introduce in the healthcare company, to induce all national healthcare operators to ask many questions when the technologies are in the phase of purchasing evaluation. The simple question: who are the patients for this technology? What's the advantage that new technologies have compared to currently used technologies, what has to be dismissed using these new technologies. So there will be levels, diversified levels of complexity to base the reasoning and to find an agreement with the regions to understand which are the approval levels. Some things will be approved directly in the companies, others outside, would require, due to the complexity or the financial scope, regional approval, and other assessments that are even more impactful on the system that shall be assessed at the national level. Again, I would like to further stress the theme of training and communication, because only through this cultural change we can hope to reach that level of implementation we expect from the assessment documents that are being produced. We shall also work on the integration of information flow. With no data, we cannot govern. Here, we are supported by the role that Agenas took on some years ago as the National Agency for Digital Health, and the whole work we are doing on the medical investment that foresees the launch of a set of activities and consultations and assistance. These are all data and insights that will then flow into the ecosystem of healthcare data, and they would stand for an important starting point to access those insights and data that are needed to understand what's happening and what we are assessing. Information flows will be created, and we have factored this in. The national plan envisages in the new program a working process that starts now and goes on until 2025. Then there are important integrations that have to be done. Minister Schillaci was mentioning this. These assessment HTA activities have absolutely to be interconnected with other actions in the system, referring to the essential levels of care, the connections with the DLG, the reimbursement system, the national system. We agree that these are all connections that have to be created, and the program envisages the creation starting in 2024 of a whole set of working tables, and we hope might lead to results in the timing of this program to proactively conclude and finalize all the HTAs for the processes that are needed for the actual implementation of these technologies. Another important moment for the implementation is the integration with the Observatory Center of Prices. So assessments and also understanding which are the market trends. Finally, as I mentioned, cooperation with the regional network. Monitoring, again, is an important issue, both in terms of the performance of the program and the development of impact indicators. We, as Agenas, want to be measured in terms of how we want this national program to work. So we will try to set a whole set of indicators, and also, we also want to measure the actual impact. As for the areas of integration, besides from what I've mentioned, a further focus on digital health, updating the minimum levels of assistance, the LEA, and the ESI national program. Many of these technologies would then lead to clinical benefits, but we need to understand which are these clinical benefits, especially those technologies that are particularly innovational and will lead to a cost increase. Thus, the connection with the creation of IT flows, allowing us to understand what is actually happening when we introduce these new devices. And so reference was made also to the national program of the outcomes to identify outcome indicators. I recall also digital health and telemedicine that shall allow us to have a data bank to organize technical and scientific international activities, the ex post evaluation, real-world data and evidence showing us if we are reaching the goal or not. I remind you that when we assess a medical device, unlike drugs, the effectiveness of the device depends a lot on the context, the professional skills of use of this device. So it can be the best of class device with the best efficiency rate, but if the organizational context and the professional competences are not capable of valorizing the efficiency of this device, it's going not to produce the expected results. The timeline, I don't go into the details, just to show that there are 11 macro stages in parallel. That's a complex working program. To mention the evidence program in the technical proposal by Agenas, we have forecast in this 3-year time the role of the monitoring center to formulate a proposal to start this evidence-generating program that is in line with what's stated by the regulation of EU on technology assessment and also in line with the experience of other countries. I recall once again the German and the French experience with a lump sum program, with a controlled program for the creation of scientific evidence and financing, reimbursement, eased solutions if evidence is produced. So there are many experiences we would like to embrace in this evidence program to increase the level of attractiveness of our country for international research. I'm going to my conclusions, inviting you. You have in your folders today this QR code and also the other participants remotely connected. We had 262 participants connected from Italy, 62 from abroad. We have also service of simultaneous translation into English, so it's important for us to have your feedback as to our presentations. So for the Italian participants, please do scan the Italian QR code, and the English participants might scan the English QR code. Thank you.
Tra I tanti complimenti che mi sento di fare, dottor.
My congratulations for your remarks and great contributions, and also for respecting our time. We're going to start our roundtable. Some of the things that you briefly mentioned will be part of our debate very soon. And I would like to call Achille Iachino, I see he's here, General Direction of the Medical Devices and Pharmaceutical Service within the Ministry of Health, Professor Americo Cicchetti, General Director for Health Planning in the Ministry of Health, and Dr. Anselmo Campagna, a Technical Coordinator for Health Commission of the Regional and Autonomous Provinces Conference.
Sono evidentemente tantissimi gli.
There are lots of interesting parts that we could start with. We really have to look at specific aspects. And my first question is, what is the role, or what do you think is the role of those who are coordinating and the price observers of the technologies, of the devices? What can we expect? Thank you, and good morning. Thank you, Agenas, President Cascioni, Mr. Mantovan, for organizing this event that allows us to illustrate with this important step of this long path that we have gone through in these years in order to be fully implementing and concrete as far as all the activities are concerned. There are the concept of new governance of medical devices embraces different changes, opportunities, and aspects. We should never forget, when we look at the new governance, we should also consider that there is something in progress. We need to keep what we have so far. We have to maintain it from the operational point of view. I'm talking about notified bodies, activities related to the vigilance actions, other relations with the different stakeholders. And I really thank the collaboration with the regional and national authorities, with the industries, the management stakeholders. This new governance was born because in the years, in a very fast way, especially in the last years, everything that is related to medical devices, HTA, has been of great interest for more people. We talk more about these issues, but in a different way. We're doing it in a different way, not because a technology is attractive, it's just fashion or trendy. I think that HTA is more interesting because there is a greater awareness of the real possibility that technology can help us to guarantee a higher level of the health care system. If we are aware about this in terms of technology, we know that HTA is that activity that allows us to understand if and how that technology is useful. Then we are going to be really focusing and we're working on in the right way, in the right direction. I think we need more and more people, and this is connected to the higher interest in these issues. And it's also in perspective, in looking in the future, is quite natural, and it will help us to proceed and to be more successful in the future processes. We need to coordinate in a much more deeper way. We need to find actions to sum up somehow, to find a way to link all the different stakeholders, but also those who are on top of the iceberg, on top of the management systems, if you allow me to say so. So we have now a better government, much more clear governments, and we need to see what in Italy we have done so far. Also in terms of rules and regulations, Italy gave a great contribution in this sense. In this context, the role of those who are actually directing these issues is to validate the results of the activities, to coordinate among the different stakeholders that, as Mr. Marchetti said, he presented very well in his speech.
Questo lo fa tenendo presente.
And we do that considering that the goal we have is to explain why this technology is important and to give a valid contribution to give the right answers that we need to make this principle more effective, so that this technology, when we analyze it, is used within the health system, is going to be really a determining aspect within the health ministerial area, and also within the regional stakeholders, and also for Agenas. The other aspect, the other side of the coin, is the observation of prices. This is very important, even if it's complementary. If we have, for example, good technologies, but we spend our money in the wrong way, then the work we carried out for technologies is going to be a kind of a boomerang effect in the entire healthcare system.
Che le poche.
So we need the few or the higher resources that we have now available in order to guarantee the right healthcare services, we need to work on the price observation system in a more deeper way. It is not just monitoring or surveillance body which can carry out its work in a very difficult way somehow as far as medical devices are concerned, but it is more like a data bank system that works in a more focused way, that can find out some indicators, some elements that can help us to classify, to categorize the medical devices, the types, and so that we can better choose that specific product with specific consequences. And this can help us to overcome some doubts, and we can understand the reasons why things are in a certain way. So the observation of prices, the management stakeholders, we need more coordination. We need to have better reports for HTA. We need a useful database to spend in a better way all our resources to use in the best possible way the medical devices. From the point of view of a citizen, I would like to ask to Professor Cicchetti, I think that one of the more qualifying points, or the most qualified points, is in terms of integration of HTA, national program of outcomes, the governments for the medical devices and other elements. I would like to ask you a couple of words about this very complex system. What do you think about it? Thank you for this question. My answer will be to the point, but first allow me my gratitude and my pleasure for this entire organization. I'm thankful also to the Minister of Health, to Agenas, mainly to Marco Marchetti, because this has been, these people have been the engine of so many initiatives. We have developed them together with the team in Rome in the year 2000. We started this long way, and the results are really amazing. I know I have to wear the mask of a researcher now. From the year 2007 to now, we created to build the right situation, the right conditions for what we experience now. We also have a cultural background that supports the entire system, the entire program. We have this background. From the practical point of view, we need to create the necessary programs that are so far quite clear, actually. We need also to praise the regulations that are supporting us so far. Another element of the entire context, to go back to the slogan that was already mentioned, human rights. So the human rights, so to say, this is our motto to support us. It supports the entire work of all the stakeholders. Ambrogio Lorenzetti's painting that is in the public building in Siena, this painting, the facts of the good government, of the wrong and bad government are represented in this masterpiece. And this can be reflected also in our health system. What we are experiencing recently is that we were able to involve the politics somehow. When we have this kind of important tools and devices, the political stakeholders tend to make a step backwards, because the system has got evidence, has got scientific evidence. They also have got a wider level of cooperation. We have different stakeholders: the industries, the patients, the entire citizenship. So when Mr. Battista talked about an historical time, an historical moment, he was right. I feel it, I really perceive it like that. It is an historical moment we are living in. I think this is a starting point of a long way. Marco mentioned that. That is also object of his question. So the integration process. From the point of view of planning, when we talk about planning, we have a set of rules that are objectively presented within the management that I'm actually directing and managing. From the one side we have, on the one side we have technologies, on the other side we have the staff. We have the technologies, the medical devices, the drugs, vaccines, highly advanced tools, and also the high level of assistance. So it is impossible that the role of this engine, the entire system becomes an engine to pull other elements. And the integration of all the elements, what we need, the assessment of HTA, of the medical devices, vaccines, highly advanced, technologically advanced devices. We need also to develop, to do technology assessments in the different parts. We should not look just at single tools, the single devices. Also with Marco Marchetti and other stakeholders, we have been working on that. There are some drawbacks, there are some problems, and for this reason we need to cooperate with our working tables. We need to do something more. We have a specific committee. We have an appraisal committee. It works and looks at certain scientific aspects in the healthcare system. When we talk about the general level of assistance, we're not just talking, we talk about the listing, we have replacements, half of the decisions that were taken and that we think, and we hope, will be implemented in the publication of two important rules or laws are as a resources, and the citizens will see the effects of all our work. That appraisal commission work should be based on scientific evidence, on assessment activities that need the tools that we already have, but we are also to consider to go beyond the medical devices, because we don't just talk about procedures, drugs, and digital technologies. We have some connection points in terms of the activities coming from Agenas and others. I can see that, but we need to look at other aspects to assess. We need Agenas support, but we also need other centers, other devoted centers that look at medical devices, and they have an expertise in this sector. As a consequence, we need an update of the devices and tools. It is a table that regards the entire system of the fees, the daily surgery and daily visits fees. We talk about different aspects where we have to work on. also we need to strengthen and restructure our way to define the medical and healthcare fees based on scientific evidence. Furthermore, another area that we're dealing with, because we're competent in this, and where there are some important cooperations, is related to health building area. And in Article 20, we can see that we don't talk about infrastructure and buildings, but we talk about technologies too. Together with regional authorities, we have to think how to update also this aspect in terms of assessment of the different actions that were funded thanks to Article 20 and other funds too. I think we need to understand how the HTA National Program for Medical Devices can be integrated in order to accelerate the entire process, because we have
Ripartiamo da quelle, questo credo.
We have already done some assessments. We have to start from there.
Sempre più robuste. Credo che
we need to grow stronger and stronger. Productivity of the health national system is absolutely important. It is also the heart of the entire system. I've always believed that, and I still do. We need to govern in this way the entire healthcare system, and I'm really satisfied in terms of results so far.
Dottor Campagna, il piano...
Dr. Campagna, the national program of HTA is strictly connected to the national system in terms of connections and cooperations with the regions. Professor Cicchetti and the previous speakers, like Professor Marchetti, do you think that the regions are really ready? Do we have to recover somehow to fill in some gaps? Do you need wider cultural approach? Are there any gaps between the North and the South, for example? Good morning, everyone. Thank you for inviting me here. As the previous speaker said, we really thank you. We thank all the institutional figures, Professor Marchetti, President Coscioni, and Mr. Mantovan. They have been pushing a lot towards the last impulse of this program, because it is necessary, and it was necessary in the past too, but today is even more, because we can't deny that the quality of the services that we offer in terms of healthcare need a sustainability program. As a consequence, we need to keep the technological level at the right level, and we need the right governance. We need, as we previously have heard, to have also an investment plan that is of a certain level. The management, stakeholders, the level of approval of the different regional investment programs, all these things need to be crossed and connected also at a regional level with the right approach. Every single plan, national or regional plan, has to consider this aspect. Unfortunately, there are so many actions and plans in terms of services, in terms of technology, that are not always in line. They are not always homogeneous. And we need to have more homogeneity in the entire system. Citizens need to have the very best treatments. We need to find the right answer to the citizens' needs. So for this reason, we need to guarantee the right services, the right offer. Citizens want to have access to the services and to find services that are quality services in terms of technology, in terms of clinical outcomes. I think that we need to work further in terms of training and harmonizing the regional authorities to be more harmonized with the entire system. We need to structure the workflow about the introduction of new medical devices. From the national point of view, we have to focus on high-cost, high-impact technologies, also from the organizational point of view. But also we need to consider the clinical impact, because we need a workflow that is efficient and effective in terms of time. We should not forget that many of these programs from the year 2007, the regions have tried to develop within their internal institutions to introduce the new devices through HTA, but in some cases they have been partially failing because the time devoted to analysis, assessment, introduction after approval, and the different steps, this time was not the right time if compared to the kind of service.
Punti di attenzione.
We need to consider, to ponder this aspect too. We need to have a governance that works hand in hand with important decisional making actions and programs that are not only at a European level, but also at a local level. We need to be working in due time. We need to be respecting certain appropriate deadlines. We need to have an efficient network that is not just supporting us, supporting the central, the core of the institutions and stakeholders. The regions are, of course, the regional authorities are very pleased to work hand in hand with you to give their contributions, to share their expertise from the regional and from the company point of view. Of course, the professional approach, the willingness to keep on collaborating, this is something that the regions are doing. We need to look at the need to purchase new medical devices to have a very good cultural approach. But, as I've seen also, the importance of monitoring, of supervision, I think this is something absolutely important. We cannot have a mechanism that has no real structure. But we also need a monitoring system, a supervising system that looks at the needs and assesses the decisions that were taken, so we can have the right balance. So the regions have confrontation tables. They can share their results. They can talk about the results that they need to reach. Another important element that has not been part of this the objectives of the plan, when the cultural approach has seen good outcomes, and we have created a strong basis, we create standard actions and measures. We need to find an accreditation system. We need to create standard measures, standard elements that when a certain service has been approved, we need also to verify that the offering of certain services will have specific requirements, will consider the necessary evidence. Thank you.
Mi collego a quello che lei ha appena detto, dottor Campagna. Volevo proporvi un velocissimo giro di tavolo, proprio rimanendo...
Considering what Dr. Campagna has just said, I just would like to ask you the following. An important aspect. The right price related to the medical devices, to the technology. Dr. Marchetti has mentioned this a little bit. We talk about a French model. We could look at this French model. Can we look at this model from the Italian point of view? Can we recognize to the innovative technologies, to the technology that recognizes specific benefits? Can we adopt this system? Can we look at this French system? I'm asking this question to you.
Sì, professor Cicchetti.
Please, Professor Cicchetti. With this instrument, what we have available now, we can imagine a governance model that is different to the past one. Also from the point of view of funds, of the financial aspect. We need sustainability, of course. We need to work step by step. But it is quite clear that HTA allows us to differentiate the value of technologies, discriminating the level of innovation from the technological point of view of these tools, but also the potential value growth that some specific processes have. I think that this is going to open the way to new evidence that allows us to, if you say it in inverted commas, to reward somehow, to give an award to innovation. We are not, of course, against innovation, because innovation with a value is something that can only improve the entire healthcare system. It generates health in this way. So it is quite obvious that this kind of program can just be associated to further pondering about the possible alternatives. What has a value, what has a minimum value or no value at all? Today, we think about these things maybe in the same way, regardless of the innovation. This is the technology we have. Maybe we look at the drugs, the medicines, maybe they forced us to think about these things in a different way. But if we look at things in a more wider way, we need to look at the world, we need to look at other examples. We can exchange experiences in the entire system, the update system of the LEA. So what we have experienced with drugs can help us to find new ways to create new governance models where we're going to see the system with a value-centered approach. I hope I was clear enough. This is the time when we have to ponder about these things. We have to think about these things. We can't say more. Maybe from the technical point of view, maybe this is a tool that we can use to decide what has a value, what hasn't got a value, in order to stimulate, to spur, to encourage new innovation in new innovative systems. We are missing the chance. We're going to miss this opportunity if we don't do that. So we're also to look at what is not innovative, something that has become a commodity. What is for us something that we can consider affordable, but that has no real good effect, no real good outcome in terms of financial balances. I think this is the right time. We don't have to miss the chance.
Do you agree? Well, I subscribe to what Enrico was saying, and I add a very brief consideration on the fact. First, the HTA, as well as all the processes leading to the updating of the minimum levels of assistance and pricing. When we talk about medical devices, they all have to be based on a fundamental assumption, a regulatory system that would provide answers and certainties. Otherwise, it's clear that we would not be reasoning on HTA of medical devices if we wouldn't have upfront a system guaranteeing in a way that a certain number, well, technologies is just a part. In the data bank, there are more than 1.5 million medical devices registered today, and even more than 1.5 million. So the support of the regulatory system is capable of giving to these processes. It's a reality. It's not something. Of course, we need to work on this to improve it, but it is already existing. And again, when we talk about digital therapies, we refer to the German system. To my modest advice, it's working only partially, but that's an experience we need to look at. Maybe the France one is a bit more interesting. Anyway, digital therapeutics uses software or apps. The rules on medical devices referred to a software already dating back to the first 90s. So it's nothing that is fully unknown to the system. The regulatory system is ready to state which among the different products, and again, there are so many that every year are being proposed as medical devices, deserve to be considered suitably. And subscribing to what Amerigo was saying, we are ready from the regulatory point of view to play our role. Thanks. Also in this, the regions will have their own contribution. I perfectly share everything you said. I believe that the financial leverage, well, on the one side, it could be the management of the regional fund. On the other side, prices to pay provisioning systems. Well, this engine has to be reshaped, no doubt. It's clear that also the results, the indicators, the standards that this kind of programs can generate shall be included in the assessment system, as well as the outcome national plan and the new system of guarantee. So that on one side, we assign to the regions part of this fund, factoring in how they organize the supply according to HTA in their services. When we talk about technologies, at least part allotted for technologies. On the other side, we have to update pricing to simulate research. And as you said, there are models, European models, that are grounded on the financial return, and to consider also evidence, scientific evidence production for the medical devices. Let us not forget that medical devices compared to drugs are hundreds of times more numerous. And so it's clear that we need to protect ourselves, to leverage this network to have more results and scientific evidence as compared to what we are doing right now when we introduce a new technology. On the other side, we need to update our pricing systems. That's self-evident, promoting or not promoting certain services. I agree with you. That's something we need to do soon, as we are referring to out-of-date pricing systems that do not have a positive impact in the provisioning contracts that we sign with different entities that are not only in the public but also in the private field. So on the one hand, we need to have the private supply be equivalent to the public one, and the pricing system is the strongest leverage we can have. On the other side, we need somehow to verify that what is done in-house in the private network is not escaping, so to say, the control and monitoring, and that's at the same level as what we ask in our public structures network. Thank you. I now would like to say goodbye to our panelists of this roundtable, Professor Cicchetti, Campagna, and the others. And let us listen to the voice of the producers of technologies and the purchasing partners. Fernanda Gellona, Head General Director of Confindustria Medical Devices, Roberta D'Agostino, in charge of sourcing Consip services for healthcare, and Dr. Lorenzo Gubbian, General Director of SPA, the Lombardy Region Agency. Well, Professor Gellona, I would like to start with you. I was noticing that maybe I'm mistaken, Professor Cicchetti was gazing at you, especially when you were referring to the payment of technologies, the innovation. Maybe it's not clear. You have heard all today's presentations. What do you expect? What do producers of medical devices expect from this HTA national plan? How is it judged? And this tax, 0.75% on the turnover in general, how is it perceived? Well, first, let me thank you and greet you all. I thank the Ministry, Agenas, for this opportunity and occasion. I agree with what was said. This is an epochal moment. I recall very well that with Agenas, the HTA, the Ministry, we started to talk about it, as you reminded, many years ago. And therefore, now we can eventually materialize into the legislation, this action, and higher awareness from the politicians. And we are pleased to see concretizing what we said for many years. And we tried to test for many years with activities and works which never found its concrete application, which is happening right now, today. So our judgment cannot but be positive. We are absolutely in agreement. The HTA process is indispensable to assess innovation. I'd like to add assessing innovation, but also the field of application where innovation is implemented. We constantly said that innovation is not to be considered upfront suitable for everything. So we need a careful assessment as to where this innovation has to be inserted, and that's an equally important part of HTA. We think that the involvement of stakeholders that was mentioned by Professor Marchetti is absolutely important. Well, the case of the director Cicchetti, I don't know if I had to be scared or not. Anyway, it's clear, and I'm very pleased, jokes aside, that it's clear that the economical issue is known to all. The sustainability of the system is considered by everyone. It would be crazy that us working in this system to improve it, as our companies do provide healthcare opportunities, so by principle an improvement of one's health, but we also offer an improvement in the organization of healthcare, as some technologies like digital therapeutics not by chance to provide a relevant contribution also as to the modalities with which healthcare services can be provided. So we feel we are a fundamental part of the system. We are certainly pleased to be involved a lot. We are fully engaged. Also, and not only starting from the tax you were mentioning, 0.75%. On this, I wanted to state it clearly. Taxes are, of course, not appreciated by anyone. We pay a lot, and it's not a good time. But though we are, as we are part of a social democratic system, it's clear that we are convinced that, on the one side, we reiterate the need and willingness to be included in this system, and we need to play our part. But our role shall also be compatible with the development of the sector, with the right importance when we are doing our duty. I mean, this effort, which is very important, the financial effort we are asked, we are certain and want to, of course, fully verify that the outcome is the expected one, that it is properly used. Otherwise, it will be disappointing. We believe it is. The national plan is structured, I believe, very well. So we have many steps, not only monitoring, but the whole value chain. And we are certain that this is going to lead to excellent results. Certainly for us, it's important that there is a true enforcement up to the last mile. Last mile, I mean the purchasing procedures. It's clear that an innovation that is assessed positively cannot be purchased with a bid for a mature product. It's not the same thing, and that's important. This has a consequence in the regional dissemination that was very well exposed by the other speakers. So the need for training and protection, because we do not have to underestimate those who have to write down the bids and tenders. They're not to be scared of using for each kind of innovation, each kind of medical devices, the most suitable tool that maybe it's a bit less used, and so it's a bit scary, but it's the suitable one to buy this technology. So being also attentive to those who have to take on the accountability of tendering is another important aspect. With training and with also a system of warranties that might protect them. Still, this assessment, this effort that is asked to us for these evaluations, that is not only 075, but it's also the drafting of a dossier, producing an HTA report for a company. And Professor Marchetti, you might agree, it's not trivial at all. So it's an important commitment by the companies that, and I agree, and I appreciate with Professor Cicchetti, it has to be transposed in a constant update of the minimum levels of assistance, keeping into account that this innovation is not included in DRGs. Then what shall we do? We shall, of course, be guaranteed that the system would be aligned with what work together as for regulations, CE, marks, and oversight, and what Professor Iachino was saying. It has to follow these, all these activities, as the governance of medical devices is a whole made up of different pieces. HTA is a fundamental component, the regulatory side, oversight, monitoring, the different bodies represent different parts, the minimum levels of existence updating is another part, legal and procurement are other components. If this is not working jointly, the system would not be balanced. I conclude by saying that we knew more or less willingly accepted this 0.75 that has to be paid by the 31st December this year. So sorry, it's not good, because we still have not solved the problem of the payback that was mentioned this morning. It's true, we have been given a further postponement up to the end of November, but having to pay 0.75, that does not belong to the budget of the companies, because we didn't know when it would be applied. So again, it's retroactive, and for a corporate budget, it's impactful. So by the 31st of December, to me, it's really, really difficult. The HTA system, as you said, is finally starting, as we've been talking about this for a long time. If we wait some additional months to pay 0.75, we know that's indispensable to have it start, and we want it to start, but we need companies to bring innovations. If innovators are not coming because the country is not welcoming for all these problems, well, there's no need to talk about it. I really hope that this request is met according to sharing and cooperation that Confindustria Medical Devices has always shown and will keep on showing, because we really want this sector to progress, and the governance of medical devices and healthcare could really have this turning point that the national program guarantees. We really hope that this claim that is of good sense is met. Thank you. Thanks, Professor Gillon. I think that on this item that you've mentioned, there will be some replies at this table later on. Thank you. Now, let us listen to the point of view of those who purchase technologies, so the purchasing centers, national one. Professor D'Agostino, your opinion, what's the kind of impact that HTA will have on strategies and the building up of innovation? I joined the thankings, already being invited as the National Purchasing Center at this table is a sign of cooperation that has been started for a long time with Agenas, scientific societies, and the Ministry for Health, as well as providers of Confindustria Medical Devices. Of course, as Professor Gillon was saying, HTA, this new model is going to help us be more courageous to tender and to put as the subject of the tender innovational products or products which have a real use and functionality, clinical use for healthcare structures. Given that we have this privileged position of interfacing with different players over these years in tendering medical devices and appliances, we do not work alone, of course. We cooperate with scientific corporations that were pivotal in organizing tenders for heart stents, implantable devices, heart valves. Of course, we do not have corporations that we already know that shall be engaged in the bid. We buy for the whole national territory, except for some tenders for the Recovery and Resilience Plan devices. Again, we do not provide a single technology. We offered, given also the high numbers of technologies, all technologies available. So in the category of medical devices, we use the concept of clinical choice. Those who join our framework agreement will then have a toolkit of medical devices and shall choose. Of course, there is a first-ranking provider who offered the best price ratio, so all tenders are entrusted to those that are financially more convenient, but it can also be second, third, or fourth ranking for the clinical use, the kind of patient, the kind of intervention. We detail the tendering documentation with scientific societies. We write at commissions. We have physicians, clinicians, who then can demonstrate through the in vivo tests on samples the results. So our approach is not buying any technology in the same way. We have a fully holistic approach. If you know our tenders, if you use them, we never have two tenders in the same way. The approach, of course, is the same, but tenders do depend on technologies. What is widely spread on all purchasing of healthcare is the framework agreement model. We cannot impose centrally a single technology with a single device. There's a wide range. Of course, there are levels, and levels have to be high. Otherwise, there are some thresholds, entry thresholds, typical of a bid that is turnover, advance payments, so these constraints of having robust providers participating, and then there are quality constraints and the price. Price is a consequence of all these factors, but these tenders are not absolutely based on the concept of price. We have abandoned this concept for many years now, and basically we base ourselves on cooperation. We speak openly to all the players of the bid, the ministry, Agenas, the providers. They have to be listened to. To conclude, HTA shall help us, as the professor was saying, to be bolder and to provide products that are well used and add value for health. Thank you. Dr. Gubian, innovational technology, but also innovational procurement. We increasingly talk about this, and the Lombardy region has started or is starting a pilot project on procurement, value-based procurement. Could you detail a bit your experience and perception? First, let me thank the Ministry and Agenas for inviting me and giving me the opportunity to be here in this important moment of sharing. I would say that to date, moving from HTA, which is of course a fundamental tool for procurement based on value, we can say that the balancing of the two factors, HTA on the one side and procurement on the other side, is not that strong as we wish. I think that the new national plan shall allow the regions to ponder and enact actions to make this balance stronger. Quite often, HTA is used today, especially for the assessment of projects coming from the company after gathering the needs. So the purchasing central organization, which then plans bids and tenders. It is not fully used yet in the stage of programming, so to assess critically the needs that are expressed by healthcare companies. Often it happens in our process of gathering needs, the healthcare centers report their needs. If these are ordinary technologies consolidated, we do not perform any kind of value assessment. We sum the totals, so to say, and we see out of scope our tenders, considering the current purchasing resources. If these are technologies, the Lombardy region is organized with an HTA central hub. We have in-house staff in the procurement unit dealing with HTA, DI, work on healthcare technologies and medical devices, and they perform the assessment. It's not a systematic structural assessment of all gathered requirements, and also for the ordinary technologies or consolidated technologies, we never assess if a consolidated technology could be replaced for convenience with other technologies. I believe that until the HTA is not fully implemented in the planning processes, by which I mean procurement and investment planning, we will always need to catch up, so to say, with identifying the requirements by the healthcare providers and the immediate requests for the technology introduction. It would be instead useful to promote the introduction of new technologies in a systematic way. So even before healthcare services to express the need, and sometimes it's too late because some assessments that are well done need to use all the IT heritage that is not very well used. In this regard, it would be wonderful to do these assessments beforehand. So us, as programmers, we could indicate to the healthcare companies or suggest which technologies could be suitable to improve overall their performances and especially the outcomes on patients. One of the crucial points, more specifically as to your first part of your question, is the outcome assessment. That's critical when we want to introduce value-based projects. we have different interlocutors on the market to try and introduce value-based procurement processes. We encounter a bit of difficulties and obstacles, but first, in terms of problems, we don't have many experiences, so we need to be bold. We do not have many projects yet or actions based on value-based procurement. An HTA analysis then is fundamental because we need to identify which are the outcomes expected in terms of performance improvement, identifying a way to measure these outcomes when the contract is enforced. Again, data, pre and after, are fundamental. I believe that in all value-based procurement, the use of existing data flows and the creation of new data flows to measure whether the objectives we expected with the market are met shall become fundamental. On this, we have just a few experiences again, so we need to be courageous a bit, and HTA support is fundamental already at the planning stage of these tenders. If we do not have this kind of competencies, measuring all this afterwards, it becomes a post-market monitoring that's highly complicated. So that's one of the themes that is fundamental for value-based procurement. Then the juridical scope, we have just a few experiences. This means then that the jurisprudence is lacking, and when something goes bad, it's not to be hoped for. So if I ask my legal office, as we are doing, to base our to have our value-based tenders, I can tell you for sure that the phases of our legal experts are not always fully convinced. They see some risks moving in a new market, and so they are quite cautious, and I think that's another important aspect. Do consider that paying by result, and that's already existing in the healthcare and other sectors. In the value-based procurement, that's an important item. All in all, contracts are remarkably different, as there is a transfer of a risk share to the market. Just saying that if it works, there is a benefit. If it's not working, we would share the costs without reaching any objective. Well, on the one side, the market should be very convinced of products and offerings to agree with this kind of contract. And then beware that the introduction of a new technology does not only depend on the soundness of technology, and there are some risks, but also on how ready the adopters are, clinicians, patients, the new adopters of this technology, to have it work at best. So culture, professional competencies, usability that has to be promoted, as citizens and patients need to adopt quickly these new technologies, and that's fundamental. And so there are some risks, additional risks that are not present or are minor in typical contracts. So when we move risks, this happens in public contracts today, it happens in different product categories. We are more experienced for tendering where risk transfer is natural. That's one of the essential elements of the contract. We are less experienced in these categories of goods. So I would say that at our level, we have started to share opinions with the market, and that is giving us important insights as to finalize this kind of projects. And if we are bold enough, I think that in the short run, we shall organize some tenders or procurement actions that would move in this direction. Thank you. Professor Gubo, I would like to move faster a bit as we're receiving lots of questions from the participants who are connected. So, Professor Marchetti, well, let us greet Professor Gubbien and D'Agostino, and I would like to call at the table those who are the users in their professional daily activity of these technologies. So clinicians, hospital pharmacists, and clinical engineers. Let me welcome Professor Giovanni Esposito, past president of the Italian Society of Surgery and Cardiology, Andrea Giovannoni, head of the Italian Society of Medical Radiology and Surgery, Dr. Arturo Cavaliere, president of CIFO, the Italian Society of Hospital Pharmacy and Pharmaceutical Services for Healthcare Companies, and engineer Umberto Nocco, president of AIIC, the Italian Association of Clinical Engineers. I will start with you, Professor Esposito, on my left. The HTA National Plan is engaging, of course, you as clinicians, especially in the definition of needs. Well, I would say that physicians have the advantage of resorting to science and consciousness. You can leverage this knowledge. You are the enablers of the HTA, but you are the first to filter some needs. I would like to know your viewpoint on what is happening. Thank you. First, let me thank President Coscione Mantuan, the director, for hosting me and for wanting the scientific societies to be at the center of HTA. That's a crucial breakthrough because we are centered not only on the users, but the training of users as well. I believe there's still a gap in all this journey. We are ready, clinicians are ready, because today we are assessed as structures, as facilities. Now we are assessed as clinicians. We are valued also as professors, but nobody's telling us how we reached these assessments, which are the tools that have been used. When we see the outcomes of HTA, we don't know right now how this process is going on, which were the tools that were used to reach these outcomes. There's no possibility right now to trace back everything we are using in terms of tools and devices. Travioni said we have 1.5 million devices that are used. Unfortunately, today it happens that actually we do not trace these devices. I mean, if I perform a procedure right now, at the end of this procedure, I know if the patient performed well, survived, is doing well, it worked with positive outcomes, but I don't know if I've used 1, 2, 3, 5, 10 devices. To me, that's the first crucial point we shall keep in mind, because if the clinician should also learn to self-assess, he or she should have an idea of what's happening in the center, in the other centers, in the region, to then report on this assessment. So we need to codify medical devices. That's something that is still missing today. So not necessarily for reimbursement reasons. The outcome should not be connected only to this, the use of the device, but also being codified so that we ourselves will learn to get the maximum level of HTA, we'll learn to understand what we are using in our setting and which were the outcome resulting from the use of medical devices. I think it's an important instrument for sustainability of training. It is extremely impactful on us as clinicians to self-assess, to self-measure, to understand what we are doing and where we are going to. And especially we'll understand whether some devices are useless. If two structures reach the same result by using a device or another, well, or not using a device, that's an important point to understand whether the use of that device is actually important. So I think that we, as clinicians, scientific societies, we are ready in terms of cooperation we developed over these years as the Scientific Society I represent. We generated the value in measuring data on devices used for 30 years, and I think that's an important point, the most important point in the value of HTA, and that's a goal we shall pursue to get to the point where we can measure ourselves and be trained in time in the sustainability and use of medical devices, and to connect this use also to the actual value. Right now, we do not make a distinction if a device is called innovative. What does it mean? Innovation shall be supported by the value, the added value provided by its use. Today, we do not distinguish if a device, for example, there are no guidelines in Italy. They're going to be produced quite soon. The Institute of Health is working on this to understand whether a procedure is in class 1A or 2 or 2B, for example. Right now, this is not done, this distinction. It's a material distinction. There's no application of the potential added value in the use of this device. So we need to interrelate the outcome to the use of the device, towards the codification of the device, and of course the procedures that would lead to the use of that device. Thank you. Professor Esposito. Professor Giovannoni.
Sentono gli stessi gap che...
Radiologists for surgical radiology, do you need to measure yourselves in your structures in the regions? I don't want to repeat what the other speakers already said, but I think this is an epochal and unprecedented day. The beginning of the year 2000, the first HTA congresses, Professor Favaretto in Trento, I remember this congress where the scientific society strongly wanted and cried out for the need of the HTA program. Us, as imaging experts or radiologists using medical devices, not only in terms of equipment, but also devices, we needed this to manage our activity and to rule also the activity at the system level, the national system. So I believe this is a day for all of us insiders, is a result of what we brought forward, a project that seemed sort of utopia. In the end, we eventually achieved the goal. The fact that maybe the Minister is a radiologist was the final driver to this. I think it's very important. I thank Agenas who had this awareness. We cooperated for important projects, and I wanted to recall not much the role of professionals, but the role of scientific societies in an HTA program, because in the end, it's this joint process that could be one of the winning points of this program. More specifically, do consider that the society I'm honored to represent and pleased is gathering 12,500 professionals. It's the only so highly diversified society in the use, not only technologically, but also for implantable devices, so to use this technology. I think that all the words that Professor Maciuti said into the introduction this morning, we shared opinions on many of these steps, as it is a multi-step process. These are included mainly in the role of a scientific society for HTA. I think that one of the milestones of this information and training path is data gathering. These are all fundamental elements that belong to the work and the mission of a scientific modern society. Let me digress on your specific question. For many years now, our scientific society wanted to document the use of devices. We reported in 2022 400,000 certified procedures with the National Register where used devices and even more the outcomes are reported. At least we tried to assess immediate outcomes and also long-term outcomes. I think that's fundamental to generate a second step that's necessary for scientific society, that of trying to search for the evidence of our interventions to disseminate to all the members on the territory the results of our work. I believe that scientific society, at least our, as it is widespread and organized, we have 20 regional groups that are fully engaged in the whole activity at the central level and in the front line. I think this is a factual contribution in this process of disseminating the culture on HTA if needed. Now, I don't want to feel too ambitious, but it's a program that we had as a target for many years now. And this is also leading to a further problem, and we are aware of this when we're working a lot in this perspective. And it's important, again, to stress the role of a scientific society. That's what was emphasized this morning, the criteria for resource allocation, the right device at the right place, underpinned by healthcare planning. Secondly, the definition, and that's important, clearly, finally, the criteria by which these devices become out of date. So the dating criteria, a plan to renew devices that should go hand in hand with technological development. Otherwise, we keep on talking about technological developments, but we forget, or we might neglect, that 70% of our appliances date back to more than 15 years ago. So innovation and renewal shall follow maybe the France model of devices reimbursement. Just a couple of things. On the other side, I never heard talking about professional value. As a physician, as a professional, I need to stress it. We do not have to run the risk of mistaking to think, I call it radiology, but everything that is related to radiology as a commodity, a big device, a big radiologist. The important thing is to have hyped and cool new devices so that we have automated diagnosis. This is not true at all. Unfortunately, we witnessed the period in which we believed, and we still believe quite often, that, and we've seen also with the recovery and resilience plan, that it was just a matter of replacing a device to solve problems of waiting lists and diagnosis. Instead, it should go hand in hand: devices, technological innovation, awareness on HTA processes, and the importance of radiology not meant as a commodity. So everything that is related to radiology would be strictly connected to the professionalism of operators. That's important. Just a couple of remarks in this regard. Our society this year marks the historical change. For the first time, we are successful in organizing a joint congress with all the scientific society of radiology, nuclear physicians and radiotherapists in Milan. We're going to have this very first congress to move along the path of resource optimization centered on the patient, supported by mostly advanced technology. I think that's an extremely important milestone that shall be emphasized, as I believe that's the role of scientific society, that of being organized and producing best practice documents and reports that might be useful to policymakers, somehow to take best decisions. We heard this sentence already beforehand. I would like to conclude with a final statement concerning, it's true, it's important to have HTA processes, but we have another problem that maybe is not that relevant, but it could be the crisis of invocations of some specialty schools that in the next years could run the risk of having a gap between technological progress and lack of professionals. We have a dramatic drop this year. At the first year of the specialty school in radiotherapy, we had enrolled 20 new trainees, physicians in Italy, in 30 nuclear physicians. This means that on the one side, technology and the industry is going towards technological development. On the other side, we are not going to have the professionals who could manage this trend. So this is creating another problem. But now I would like to express my biggest satisfaction. As Dr. Cicchetti said, today we have set an important milestone, and we all need to work on this so that the HTA program would move in the right direction and jointly, as I think it's fundamental, and even more if it had been done earlier, some years earlier would be better, but starting from November 23 for the next 3 years, we will move all in the same direction. Thank you.
Annotiamo intanto mentalmente il grido di dolore della professione.
We understand that these numbers are quite appalling, so thank you very much. Health technology assessment is something that we should consider every day. We have the feeling, but maybe I'm wrong, that sometimes we used different metrics. I think that this HTA national program can definitely, as we're talking about collaboration a lot and coordination, maybe this new HTA national program can reach us to have a common and shared language. Thank you very much to President Coscioni and thank you for inviting me here. I think that we can say that there is an extraordinary innovation in the new European ruling. We can see the importance of the therapeutical aspects. The standard of care are an integrating part for our profession. We have always, considering the transversal competences, health competences, the administrative competences, and so on, and legislative ones, we always faced with clinical engineers, with service providers. We try, and we in order to have a better healthcare planning, we try to gather together the national needs in order to guarantee a better 3-year planning. We do not only look at the needs, we also take part to the bids. For example, we think that we have to discipline it in the proper way. We are members of the public bids, and in order to assess properly, to guarantee the right balance for the acquisition of public systems. And we are also involved in the technical aspects. We have to monitor that that kind of bid is going to be implemented in adherence and compliance with the necessary rules. We need to create a better system to find a model that considers the scientific method. We need to consider the importance of the quality of treatments, economic sustainability, to find so the right balance among the different elements. I think that these are the benefits of this tool. 10 years ago, we could foresee that HTA was going to be the solution of many of the problems that have to guarantee sustainability, for example. We created together with the HTA scientific community a safer community that created culture and training groups. So we really see in a positive way all these processes that allow us to have this outcome. Furthermore, I would like to remember that the flows of medical devices is also nourished by other laws and codes related to the medical device that concerns the medical devices. There is also a system that rewards the stakeholders when the flows of economical devices has to go hand in hand with cost related. As a pharmacist, we help to manage in a better way the ethnographic charts and reports. The flow should go from the health companies within the regions and to the Ministry of Health. We need to have the number of the repertoire, the manufacturing code, and the mandatory code. Otherwise, the flow will not be, so to say, clean, and it will be discarded. All these activities are functional for the programming, for the health programming system, and they are fundamental to better plan together with the HTA program. In the past, we started a shared work to praise those who were heading towards the right direction. So we created some charts related to the use of pacemakers, so that in the bids, this kind of device was going to be rewarded for the quality of the device and also for the low cost. For example, the cost of the cycle of life of a device is something that is summing up to the price of the drug, and considering the system of the bids can be part of the new system of these bids. So we need to find the right balance to guarantee the right level of quality and to recognize the role of this. The cytostatic drugs, we need vials that are unbreakable after an accidental fall. This is a quality criteria that is going to encourage the innovation in many companies in Italy as far as these systems are concerned in order to win the bids. Now we're debating about DM70, the updating of the standard, the structural and technological standards in our health companies and health systems. 5.3, we talk about first and second level LEA. We have included the board of HTA in the hospitals because the regional bids have a cutoff of 40,000 euros. So they have to respect this boundary. Many of the bids are done in an independent way, so we need a board with HTA that is systemized at a local level and needs to be coherent with and in compliance with the European rule. It is a very good way to assess the new technologies. The point of view of clinical engineers. Thank you for inviting me here. It is an honor for me to be with you. It is not taken for granted. It should not be taken for granted when we are faced with all these distinguished guests talking about these specific topics. I'm quite proud about the role of clinical engineers from the culture point of view and from the typical curiosity that is part of this profession. Ronaldo Battista, in one of our meetings in the maybe the year 2005 in Pavia, when the association was a young one, and they were talking about HTA, the clinical engineers were there in Trento too, when the Charter of Trento was written. I think this is a long way. And today we can see the implementation, we can see the good results. But it's also another starting point. It's not just an outcome. We are trying to change the so-called assessment paradigm. From the cultural point of view, we have been spreading the seeds to have a better crop, so metaphorically said. We are seeing the fruits, also in terms of procurement. It is great that we can have a multidisciplinary approach in the assessment. We are all connected. We have the same goal in assessing the introduction of technologies. We all have the possibility to treat patients in the very best way, having access to the best technologies. As Professor Giovagnoni said before, and I'm saying this using a motto that I heard some time ago, the healthcare system is made by people that work with people for people. And somewhere we have to fit in technology as well. But it's about human relationships. And this helps us to see things not just from the technological point of view. We understand what is the technology, we know how to govern it, we know how to manage it, and how to introduce it within the entire healthcare system. Benefits are there for everyone, for those who create it, for those who need it, for those who are guaranteed these services. Benefits for us, clinical engineers or pharmacists, and to manage and monitor the flow. We manage this flow coming from different parts. Those who are working in hospitals where there are about 70 different departments, everyone thinks that his or her own need is the most important one, so we have to look at this aspect too. I would like to mention two other things. Clinical engineers are here. We are active in our role in terms of HTA, but of course, we support the general managing system, but we are here also as stakeholders. I think that we can promote innovation we can look at the request, the demand for the assessment. So this is not a closed word. Going back to what Professor Giovagnoni said before, the spread out competencies that are part of many healthcare systems and facilities, the different professions, the different professionalism that we have seen so far are there, and we should exploit them. We should give them a chance to have their voice be heard. This plan needs to be implemented within a very short time, and I'm sure about that, but should not be something elegant and stylish, but should be something really effective. Because technology, especially the medical devices, are fast and evolve in a fast way, so we need to be fast also in the reaction. We need to have an efficient and effective way of using them. Do we introduce them? Do we use them? When, how, for many people, for how many people, and so on. Thank you.
Prima di arrivare alle conclusioni che saranno affidate.
Before concluding with our meeting, I would like to invite here the clinical engineers, the hospital pharmacist, Professor Francesco Saverio Mennini, Professor Giandomenico Nolo, President of the Dialogue Society of HTA, past President and current President of the Society of HTA. Professor Mennini teaches health economy and political economy at the University of Tor Vergata. He is an advisor for the Ministry of Health in this field. I would like to start with President Lollo. I would like to ask you, what is CETA doing? They've been working so far. There were preparatory works for a while. Thank you very much. Thank you to the President, Mr. Coscioni, Dr. Mantuan, for inviting me here, for having being the leader of this change. Thanks to Marco Marchetti, because behind this entire process, regulatory process with important formal milestones, the Ministry of Health, the Parliament, the regional bodies. Behind the scenes, there is a big work, a great work. I would like to add that today we have here the President-to-be. Marco Marchetti has been elected. He was elected on the 26th of November. He will be the next conductor, the next leader. So I would like to have 2 minutes to say the following. Today, many people here, maybe someone has a different view. If you're all proud of what we are experiencing, of what we have designed and created so far, I think that CETA has had a small role, maybe not a small one actually, because after that accidental meet with Carlo Favaretti, we have started important actions and measures, the Charter of Trento and others. I think that all these measures and actions and projects have underlined the importance of technology assessment and you know that how the innovation systems work. You know that there are successful times, but also times of failure. And I think that today we are experiencing a positive time because we have found the right technology. A technology that has been recognized with a ministerial law, and it is an operational system within the healthcare system at a national level. What is CETA doing and what is CETA going to do? I think it should continue to do what it has always done, but there is a problem. In the past, we could do that somehow in disguise, if you allow me to say that, but now we have to be more concrete, so to say. We have to be more visible. So we were doing our things, of course, we were doing our job, but now we are working on the surface. So we can make mistakes. Maybe we are not able to satisfy all the needs. I think we need to be the engine of a great cultural change. The scientific society, every single scientific society, should be the engine for the cultural change. I think that all the stakeholders, the current president, the future president, will have to look at this culture change. But what does it mean, culture change? It means that we have to spread out the culture of technology assessment. And this means to start from decision makers, start with them, the president of the commission, so politics. Politics should see the technology assessment as a tool, and this is not taken for granted. At a national, regional, at the regional and provincial level, the decision makers, a major, macro, micro, and macro. If we say this is the right technology, this is the right technology at the right time for the right patient, also the operator has to be adapted and be able to understand. There are two levels. There's the cultural level and the educational level. Marco said it before, so we need to develop an HTA national program that considers important training and educational initiatives. Continuous educational programs need to be implemented, and we need to be able to use the tools and the devices in the very best way. I'm also proud to say that we need to introduce HTA within the academic world. If we cannot have engineers, experts in health, we need at least to have experts in technology assessments. Otherwise, we will be running late. We will have an expertise gap. I'm talking about bioengineers, clinical experts, but also legal experts, economy experts, and so on. When we talk about the value, the legal expert has a kind of reaction. We need we have to find a way to try things, to find a set of rules and protection that are important in the public system. So training, education, knowledge are very important. We need to create a new group of experts. And I go back to what Mr. Giovagnoli said. The best technology in the entire healthcare system is characterized by the professional staff itself, not just the radiologists or the doctors. It is the entire system made by experts. Another important element mentioned by Marco is that of supervision or monitoring. If we have a regional monitoring system that decides which are the appropriate elements of medical devices, putting them into practice will be more beneficial, but it requires appropriate measures, because summing up more medical devices together in one path, it is not always regular. It is quite a complex system. We need to learn how to manage this complex system. But so far, we haven't got the clinical outcomes as far as medical devices. Also in terms of HTA, we talk about the devices, of course, but we need also to talk about something else. We have a problem in terms of updating of HTA. We need to assess the entire path, and it's not a linear path. Magnetic resonance, for example, is equal to this or that in our path. We need new competencies, a new kind of expertise. All the professional stakeholders are called to act. And I really wish that in the next 3 years that I'm going to manage, all the people involved will be able to give their contribution. This requires the creation of new innovative methods for this kind of technology. Every technology has to be innovative also for HTA.
Professor
Menini, also as a professor of a university, this topic of spreading out culture, the culture change is an investment, but there are problems in this sense. What could we do so far? I would like also to thank the President, Mr. Coscioni and Mr. Mantuan, and Dr. Marchetti too, Marco, for inviting me here to participate to this event. Also as an expert in economy, not just as a member of the scientific community. As Professor Giovagnoli said before, and President Nollo too, the training of staff is absolutely important, and the scientific community underlines its importance. It is work, it is a path that we're going through, and it starts from scratch, and it helps to increase, to see the growth of professionalism in this area. And also in the plenary session of the last CETA convention mentioned this aspect. As Nollo said, our colleague Nollo mentioned the fact that we have to fill in so many gaps in terms of academic training, academic education. But we should see the involvement of different faculties. In some faculties, they organize specific masters and specific kind of training or educational programs, but this is just a niche, if you want. We need to improve this, all the possible educational measures. And why is that? Because the culture change, and this was another goal of the scientific community and of HTA, the culture change, as I was saying, needs a complete sharing of the methods. This is absolutely important. We have underlined that recently in the last Congress too, at the end of the Congress. The main problem is the sharing of the methods. From the central point of view, there's a strong sharing, But at a local level, at the regional level, we have only an interpretation that sometimes is wrong or is not adequate in terms of what is HTA, what do we need it for, how should it be used. In this sense, the European regulation of HTA, together with the national plan of HTA 2025, is a fundamental tool for a deeper sharing. The HTA regulation says that in terms of JCA, we should consider the clinical dominiums of HTA. In every country, we need to implement and consider the economic aspects of HTA, the economic implications. Sometimes we're doing it, but we need to improve this aspect. This is a very important step to be in compliance with the HTA European regulations, but also in terms of drugs and medical devices. Also the regulatory agencies, we need to go on towards this direction. So these are very important goals. We have to guarantee rapid access to technology, to innovative technologies, but at the same time, we should guarantee a more homogeneous approach in terms of methods and technology. We need to supervise, but we also need to, as Mr. Cicchetti said, also at a ministerial level, we need to discriminate among the different innovative technologies, and we have to find out the right ways, for example, in terms of drugs, ways to favor the access to technology. We need the proper analysis and the proper assessment involving HTA. Last but not least, in terms of methods and assessment methods and system, in the past, we deeply wanted to have the 6 simpliciter we used for the drugs, also for the economic assessment and for the HTA and for medical devices. But we cannot mix up the things. Things might seem similar, but they are not. This is another important goal. All the scientific communities, not just CETA, we need to clarify, to see the differences when we do the assessment of a specific big, important medical device in comparison to a drug. One can be more rapid than another. For example, when we talk about specific tools, if compared to the drugs, and this requires a kind of adjustment in terms of the model of assessment that has to be different if compared to the drug. And I conclude here by saying that what we have said so far today will not be implemented if we don't overcome 2 problems. The first one was mentioned by everyone. It is a problem related to data and information. We need to make it easier. We need to gain an easier access to data and information. Otherwise, the assessment is not possible. The second aspect, from the year 2006-2007, we haven't got a national plan in our health system. We need to plan, to program in the field of healthcare. Otherwise, HTA will be at a side within the entire healthcare system. Thank you.
Ringrazio il Presidente Gian Domenico Nollo.
Thank you very much. I thank you all. I am going to call the President of Agenas, Professor Coscioni, and General Director Mr. Mantovan, but I also would like to give the floor to Dr. Marchetti. Some people ask some questions. There are so many questions. You will be given a reply as soon as possible, but not here. Now let's see. We have also conducted a survey during this day. Some numbers, some data.
Le persone diciamo che ci ascoltavano.
People who listened to us so far, they answered to this survey. The first thing that we noticed is that the majority of people who replied come from the industrial sector. They represent more than 60-70% of our answers, and operators of the health system are about 12%. This is a signal. We cannot ignore this. The second point is that more than 80% declare to have a general knowledge of HTA, and this goes back to what we have said so far as training and for information and so on. But many people understand that all this issue will have a great impact on their professional life. Just a short remark. Some people listening to us, who shared with us from abroad, from another country, many of them said that there are elements that can be applied abroad, so in other countries too. Just some words to thank someone. Thank you. I would like to thank the director and the president because they believed in this project. The commitment. This is the basis to go on. I would like to thank all the people who helped me to be here today, because today we have presented a program, then we have to implement the program. I will mention them. Alfa Balsamo,
Santuri Michela, Venieri Silvia e Antonella Cavallo. Ultimo.
Final thanks. We talked a lot about communication and information. I would like to thank all the colleagues of the office, Abruzzesi, Vicario, Eugenio, because we organized the event today, but then we have to organize the communication and training.
A conclusione di questo.
To conclude this day, that's very important and quite challenging, I would like to entrust the conclusions to the General Director of Agenas, Dr. Domenico Mantoan, as you prefer. Well, the President is the most important and will speak as the last. Well, first, I'm extremely satisfied about the success of this day. Over the last 25 years of my professional life, there have been two Greek myths for healthcare. You know that the Greek myth is not narrating the truth, the reality, but something that is different from the reality. Hospital territory integration and HTA.
Abbiamo fatto convegni.
We organized conferences, wrote books, stories of the integration between the territory and HTA. These two myths have been transformed from myth into reality because the integration hospital territory, we have the M77 and HTA. Eventually, today, so on the other side of the world, so not drugs, but medical devices finally reached its organization system. I'm an organizer right now. During my life, in the end, I started in a way, I grew up in another way, and I'm finally an organizer. So that's now the moment of organization. And we have set up a system at the end of this journey that saw the commitment of so many people. And I have to thank myself, Professor Cicchetti, Marchetti, Mennini, and of course the minister who absolutely supported us, as well as Director Iachino. because in these 2 years, we have forged this system. We get angry for disappointments, but in the end, it was not so easy and to be taken for granted, reaching the very final moment. Well, in the Italian healthcare, there's always a pillar, and I would like to thank Professor Di Pilla, who helped us as well, because the final decrees were approved by MEFA. Otherwise, we would go nowhere. So to me, the positive things that we have achieved, and I'm saying this to the directors of the ministers for health, to all the different managers, that's a model that is systematizing this complex engine, the organization of the Italian healthcare, the state, the regions. It's complex and complicated. As the President said, healthcare is complex, but it's ascribing a role to each player, the Minister for Health, the Monitoring Center, Agenas as a technical coordinator, the High Institute for Health, drafting the guidelines, the coordination with the regions to identify the best centers and to promote the growth in terms of capabilities for HTA, to then reach the proposal by Cavaliere saying, let's organize the HTA units in the hospitals themselves. So I think we have shaped a mechanism that, without spending money, I remember that at a certain moment it was so cool to create the HTA agency, but we were fed up with so many agencies. We had to leverage what we had. So we have put together the central bodies of the state and the regions, and now we have to start working. Today, politics has given us 2 or 3 important messages to us operators. Minister and Zaffini, Senator Zaffini, said 2 important things. We are giving lots of funds to healthcare. Well, beware, I'm not making a political discourse. For 10 years, healthcare had just a few money and were ruled with caps, expense caps and payback, and mentioned today, so cap on staff, a cap on drugs, devices, and private accredited private services. After the pandemic, healthcare expenditure has extended, of course. We are constantly running out of money. There are those who think we need more money. The economists, and I do not share this position, would say that Germany, 8, 9, 10% of the GDP, and so it's different compared to Italy, and so on and so forth. We are a country that is under a debt. We have many financial needs, and we need to live with the money that the government and the state decide to allocate for healthcare. In absolute terms, I come from the Veneto region, so I don't look at the GDP, I look at billions. 134 billions are much more than what we received in 10 years. It was 8 billions in 10 years. So this increase in funds in healthcare is much bigger compared to the past. We need to help politicians to spend this money properly, as Zaffini says. Otherwise, we are wasting our resources. And then the citizen, because the ultimate goal of our action is citizens, they have expectations from the public healthcare system. This system shall treat patients. We have a successful healthcare because we spend a few and we have high life expectancy results. We have to support politicians to take important decisions. Frederica, the president, conveyed 2 concepts, trying to provide quick responses to innovation. So here we have the industry. We are at the wake of an important investment on the territory, the organizational model, telemedicine, telemonitoring. The telemedicine and telemonitoring, it means new devices, brand new stuff that I could not even imagine, but you are studying on this. And in short, you are going to introduce the device that measures the glucose level or the dose of a drug for chronic patients in real time. And we are paving this new avenue. This data will go in the national platform and in the healthcare reports. So we have also solved the problem of data. HTA assessment also needs to measure outcomes. Today, we are investing by which the healthcare data of 60 million Italians will all be populated in a data bank, will be used by law for those who want to program or to research on HTA. We are working on this. We still miss the final decree. That's a decree because regulations were already issued, but we are finalizing this revolution. The other message by Frederica, bold decisions that have to be supported by scientific evidence. Campagna, maybe they agreed, I don't know. One of the decisions was mentioned. Is that we are defining standards, and these standards shall become accreditation merits for the public and the private. It's a bold choice to raise the bar, to say you are better or less better, and this would entail bold decisions like removing the accreditation, being removed from the system. And this goes hand in hand with what Bellantoni said. Just to emphasize this, I'm pleased that he wants to deal with the assessment of hospitals. That's a competence of Agenas. Sorry for him who has to go on with this work. Of course, he can be a consultant because it's a competence of Agenas. So I thank you. Let me thank all the operators, all those who worked for this revolution. Let's stop with words, lip service. Now we need to work to solve all the problems we raised, to create competencies, professionals. A whole work is starting, and we need to follow up the different sectors at the ministry, the Healthcare and Planning Directorate. It's a new task, and we shall follow it up. I conclude. Again, I repeat, I come from the Veneto region. We are very careful about the SK, the 075, the tax. So as for the question by Professor Gelone, well, I would like to suggest a proposal, then those in charge might evaluate. For 2024, 075 has to be left for 2024. For 2023, as the HTA decree was approved by the state and regions on the 9th of November, you could have a payment of 212 of 075 for the year 2023, like the IMU tax. Thank you. After this full range of opinions by Director Manto, I simply go straight to the thankings for the sake of time. Marco Marchetti, of course, is increasingly showing out as a key person in the system of the national healthcare, not only in the agency, but fully. And this thanking goes also to all the cooperators and friends of the agency that are supporting you to go on with your program, with this program. And clearly, all the speakers, friends, so outstanding, the high quality of all different presentations. It was really interesting. The ministry, regions, scientific societies, the industry, these are all extremely important components. And I would like to conclude by thanking our moderator, highly competent and careful. Thanks to Stefano Di Marzo, General Director of About Pharma. With this, I can conclude this day.
Da quando guarda io ho negato un colloquio?
Però è anche simpatico.
Ti piace questo?